Listeners, you are going to love today's episode. We chat with Dr. Bhavesh Patel, who teaches us that the best use of AI in healthcare isn't about replacing doctors, of course. It's about giving patients the brain space to actually understand what's happening to them when stress levels are through the roof. So let's go. Hello and welcome to Pulse Amplify, where we sit down with the leaders and changemakers shaping the future of health. Proudly brought to you by Pulse IT News. I'm your host, Louise Shaper.
And I'm your other host, George Margellis.
Now, today on Pulse, we've got a really special treat. If I ever thought, man, we should make this a video channel, today would have been the day. In an era where artificial intelligence is beginning to transform every aspect of our lives, questions abound about how we responsibly and effectively integrate AI into the most human of endeavours, a clinician's relationship with and care for their patients. Our guest today is not sitting back and waiting for others to answer. Associate Professor Bhavesh Patel is a senior paediatric surgeon in Brisbane who works across public and private health. He's an impressive surgeon, yes, but what makes today's conversation particularly fascinating is that Dr. Patel is not waiting for AI to transform healthcare. He is actively experimenting with it in his clinical practice, exploring how these powerful tools can enhance patient care, improve outcomes, and support the complex decision-making that paediatric surgery demands. So today we'll discuss his hands-on experience with AI, the challenges and opportunities that he's discovering, and what the future might hold for AI-assisted paediatric care. Bhavesh, it is so great to have you in the studio. Welcome to Pulse Amplify.
Thank you very much for the opportunity. And thanks for the invite.
Yep, I'm really looking forward to this discussion.
Yes, it's going to be a good one. Okay.
Same. It's always fun talking about this.
Well, Bhavesh, the first question I have for you, is it really you, Bhavesh Patel, the human, joining us today, or did you send your AI avatar to do the interview?
Yeah, it's not there yet, but it's me.
Does that mean you also have to attend meetings yourself? You can't send the AI yet?
I'm close, but today it's me.
Oh, I'm glad you got here in person. Now, last night I was hanging out with your AI avatar and I asked him so many questions and recorded him. So I asked our AI Bhavesh how he would introduce himself into a podcast about digital health. So let's listen to that audio now and you can tell us how close your AI got.
I'd say I'm a paediatric surgeon passionate about using tech and innovation to make children's healthcare safer, easier, and more personalised, because I believe better answers can change lives.
How did he do?
That's a pretty good intro. It does a fantastic job, doesn't it?
Done. Interview done.
Life would be a lot easier if you could just have that do it all for you. But in your own words, tell us, where did your interest in, and I'm using a pun here, cutting edge technology stem from? Was there a particular moment or patient experience that made you realize that, hey, this system needs to be redesigned and I'm going to play a role in that?
I think in our field, you're always looking for better. And this is just a logical extension of that. And so whatever it might be, you're looking to make improvements. How can I do this faster? Even whether it's a surgical technique, how can I shave a minute off? Or how can I make it safer? How can I make the wound look better? So to me, this is just a very simple extension of that. We know that 70% of all adverse outcomes in medicine is usually something to do with communication. And this is a very easy way to try and make improvements with that.
So that mindset of continuous improvement, which is ingrained in us in medical school, is something obviously you've branched out into AI and other technologies. I mean, was there something in particular that attracted you to those technologies?
I've just been interested in technology for ages. So since I was a child, I was playing with the first computers.
Oh, now the interview is going to go off track, Bhavesh, because George is going to want to talk to you about all the tech he has in a drawer at home from childhood.
I've had all of the first tech things. So I had the Palm Pilot. As a child, I worked off an 88XT running my dad's garlic bread factory. And so I used to run his business through that. So text-based, it was a green screen at the time, and we used an accounting software that I ran off these old computers. So using MS-DOS and doing very light programming here and there. And then you start building. And this is before computers had sound. And so you made the computer do the beeps at different frequencies to create music. And then sound cards came out. And so you build music, and it stems from there. So to me, technology is a friend, and sure, it's something to control, but that's just something to play with and build.
If we had many hours at disposal, we could sit down and have a long chat about that. But next time up in Brisbane, I think we should sit down and compare notes about the gadgets in our garage.
Sure.
No, that's great. Now, Bhavesh, I found it difficult putting together the questions for today because you are incredibly impressive. I'd love to talk to you about calligraphy, but, that's a whole different podcast. So I thought, today I really wanted to focus particularly on the AI avatar that you've created because I don't know any other clinicians that are doing that yet. And I think across the world, you would be in a select group of few. So there's so many things that we can learn from you. So you've been experimenting with AI in your clinical work, not just for administration purposes. So tell us a bit about what you've done and what does that look like in practice?
Let's just imagine the scenario. The child is in my consulting room, and usually it's the mum who's with them. They may or may not have another sibling who's also in the room. So how much attention do they pay to listening to what I have to say when they have to control 1, 2, 3 children maybe, and one's climbing up and getting bored and flicking the switches and playing with the taps, playing with the rubbish bin. It's not a scenario that allows good communication. You can't take anything in. You can't make a decision. And the child's come in for consultation about something that potentially requires an operation. Now, that's a big deal. And there's no brain space. And I see it every day.
Every mum listening will be going, yep, that's my life.
Yeah, correct. And so she has to listen to what I say and then ingest that somehow, make a decision, and potentially book the child for surgery. And then her partner at home, they have to explain it. And they have to explain it to the grandparents. And there's just not enough brain space for that. And so for me, I invested in learning how to draw better than the simple stick diagrams. And so on my website, you've got much better diagrams, and I learned how to do little animations. And I asked them what sort of information they want. And so it started off with just website and pictures and diagrams, and that seems to do well. I made little YouTube clips of the various procedures that I do, and that helps. I put the QR code on the website so that they can have the site directly on their phone. And then as the technology started getting better, avatars came through, and then it was an easy progression to say, well, why can't I do a video of myself talking to people and having a full explanation? Now, for each patient, for me to have the discussion with the family, and then when they leave, go and record myself and spend another sort of 5 to 10 minutes, that's just not going to work. And so to see these avatars still be a version of me as a one-way avatar message, then it's just a simple video message that they can get. And as long as they're expecting it, then they can then share that link to whoever they want.
I love the philosophy that you've got behind this as well. It's not just geeking out. It really is about how do I be a better surgeon for my patients? And being a better surgeon isn't just about the skill that I have developed in the operating room, but it's actually about establishing that relationship, listening to what people need and want, and working out ways that I can give it to them.
90% of the people I see either don't need an operation or won't get one. And so most of my work is consulting and communicating.
I've got so many questions, and I imagine the clinicians who are listening, there'll be a section of them who are freaking out at the idea that you have no idea what questions people are asking your AI avatar and what it says. So how do you evaluate? How do you feel safe that your AI is out there representing you well?
Oh, it's only out there as an experiment at the moment. So it's gone out to a few people, but it's there just to show what the capabilities are rather than being a clinical tool at the moment. And there's no doubt it gives out wrong answers, because when I'm experimenting with it, I'll ask it questions and it says things that I don't do. And so right now it's not safe for clinical use. So I put it out and I have it there with the families, and I'm just listening to the conversation and what they ask. And that's really interesting, because then once they engage and once they see that, oh, I can talk to this thing and I can ask it more questions, they ask me the same questions that they've just asked me in person. So you really need to have a system that allows them to continually ask questions in different ways. You modify your approach. So these are things that need to be looked at. We need to analyze this and see where it's heading.
How did you train it? Because we know what massive safety issue. The variability in healthcare is extreme. How did you train your AI to represent the types of things that you would say and what's important to you? I imagine it can't be just like a generic model.
Have you played around with the generic ChatGPT models?
Oh, yes, it's learnt me. So it's gotten quite good now because I've been using it for so long. So is that a similar analogy?
But that would be the same. That would be the same for other people just using ChatGPT with its history on, that it knows what you want. So for me, I want brevity and I want no fluff answers. Now, this does have a ChatGPT back end, but it may not know your history. And so it does give a generic answer, but I've put in the information from my website as its knowledge base. It still goes out and looks things up on the internet, though. That's part of the training that I need to put through.
That learning curve. Sorry, George, I'll shut up in a second so you can ask a question. Sorry, my mind's blown. Would there come a time that, again, just for experimentation purposes at first, where having learning from your real live consultations, so, having the patient and the family give permission to have, just like we ask now for AI scribes, but that it would be used to train this? Is that something that would be in the future?
Yeah, so that's a huge topic, right? All of these AI scribes now. So let's take this into a surgical context where you've got a robot, and there are now many, many robots around the world. Each operation that's being done is being recorded. Now, you could take all of those operations, all of the movements that the robotic arms are doing, and then learn from that. And at some point, the robot can probably do the operation for you. It's learnt the moves, and with its vision capabilities, it can see the structures. It can even coach the surgeon on making sure that the movements are more ergonomic, more efficient, and safe. So the same thing can be done from a communication point of view. As a large language model, it can then coach you with how to say things. And that's currently what it does, right? You put questions into it to reframe this paragraph for me. And so it changes your communication style. Say it as if I'm saying it to a 5-year-old. Okay, that does that for you. So it ends up being potentially a trainable device where it can take over the conversation, but it understands the theme of what you're trying to get across, which is pretty scary, right?
Scary, but exciting.
Yeah.
Time for a quick break, but don't go anywhere because we have lots more to talk to Bhavesh Patel about, including I even stop asking questions so that George can.
So anecdotally, surgeons aren't necessarily known for their communication skills. You have a definite difference from what we consider to be the standard surgeon, but the importance of communication in medicines can't be denied. And the reality is that when you tell someone your child needs an operation, they probably do go into a degree of shock, and probably anything you say after that is lost. So this continuous communication, does that actually change the empathic relationship you have with the patient? Is the AI additive to empathy, or is it replacing empathy?
Oh, that's a good one. I think the fact that the facility is there to go home, and when the child is asleep and when you've got some brain space, you can then have a conversation and ask all of the questions that you didn't think about at the consultation. I think that facility, the fact that I've made that available, I think demonstrates empathy.
I would agree with that. I mean, at 3:00 in the morning, I assume you'd be less empathic if someone gave you a call to have a chat about the patient's surgery then. So,
and I'm sure that's when the questions come up.
Absolutely.
You sort of, I forgot to ask this. And it may just be something really small. Like, I forgot to ask, when can they go swimming? Or we've got this camp coming up in 2 weeks' time. Will they be able to go to that? It'll be something usually really small to the clinician, but it's a big deal for them because they have to change their entire plans. That's where I think it can help.
Excellent. So what sort of reaction do you see? Different cohorts of patients have different reactions. I guess since you're a pediatric surgeon, your patients and their families would tend to be younger. So how does this compare? I do most of my work in geriatrics where we have a very different reaction to technology.
Yeah, this is still new. And so they're still wowed by the technology. And so they're okay with it. The interaction, especially if English isn't your first language and they're interacting with this thing that speaks really fluently and understandably, and it answers their questions, the satisfaction they have on their face, you can't measure that.
So they can change the settings to say, speak to me in German or Swahili or whatever.
Yeah, I think the interactive one has 30-odd languages.
Nice.
Where do you see this going in the future? How do you see care being redesigned in the future with these sort of technologies?
So here's my future prediction or thought. I think scribes are going to become the norm. And I hope that people aren't reliant on the agent that's part of the AI scribe to give ideas and help with the conversation. It's the reliance that's the problem. With all of these scribes, people concentrate with, I want to deliver the communication in this style because I like this style. Now, to me, that's not necessarily full of empathy. Now, what I think will end up happening, and it's just a concept right now, is I think what will happen is you'll have the conversation based on your clinical acumen and your skills. You'll end up having a conversation about diagnosis and plan. Now, the transcript, call it a transcript token or some concept like that, where you'll receive something in electronic form and then you'll be able to interact with that transcript token. So either you'll be able to ask the question from the transcript, and that might be in verbal, it might be video form, it might be infographic form, or a summary or bullet points of the transcript. And so I think in the same way that when you interact with ChatGPT, you have the ability to coach it on how you like to be communicated with. The same thing will happen with these transcripts, is you'll have the information in the way that you like to ingest the information. And I think if I was predicting or if I could change what it's going to be like in the future, I think that's what makes sense to me. And so then your own agent can be responsible for listening to the transcript and saying, so your doctor talked about getting a scan in 6 weeks. So do you want me to schedule that in, right? Do you want me to go and find the nearest place? And that's what the agent will be doing for you, but it'll be your agent, not the clinician's agent. And so I think that's where we're heading.
So what's required right now to shepherd in these new tools for surgeons and for clinicians in general? Because I know it's early days, but in a few years' time, like you said, it's going to be more commonplace. So how do you stay on top of this? What do we need to do to prepare so that clinicians are actually leading the charge rather than watching it all happen?
I think we first need to understand how it works. And especially with LLMs, really understanding its deficiencies. There's memory issues, there's context issues, and then factoring in the bias that's involved. And so all of the opinions out there, not necessarily fact, end up getting overrepresented. And so that's one of the dangers that we really need to understand. So in terms of education, I've spoken to a couple of universities about this in terms of how do you build education for AI. It's still critical thinking. You still have to be curious and you still have to question everything. And more so now, because some parts of AI communication is still in the black box. And so the explainability is not there, and it may not ever be there.
Yeah, I didn't see that getting better. Mm-hmm.
Yeah, correct. And so how do you then establish what truth is? I think the next few years are going to be challenging.
Any suggestions for clinicians where they should go and which websites or which groups you think are worth keeping an eye on?
Oh, there's so many courses now, but I think just go to the big companies that will demonstrate and show what the basics of AI is. For an Australian context, the Medical Council, APRA, just understanding what the rules are, what you're allowed to do, what you're not allowed to do, and especially things like consent. If you are using AI, you have to be really careful when you're uploading data into whatever AI platform you're using, because it's still potentially accessible and it's going out of the country. So things like that, you just have to be very careful with.
We're all in the same community of clinicians who want to innovate, and they get very excited about this, not just because they're complete tech or data nerds, but because they really care about their patient and they want to utilize technology to improve the experience and improve the outcome. But bureaucracy can block innovation. And there's also the fear of getting it wrong. And like you said, doing something that would cause people to scrutinize your practice. You've talked a lot about the importance of cultivating curiosity. So how can hospitals nurture that mindset of curiosity more deliberately and enable innovation in a safe space?
I'm still questioning this. It's hard to find an easy, safe space. So something like a learning lab where you're cornered off and you're sandboxed. So internet is only within that little infrastructure, and you do whatever experiments you want, and you know it's not going to get out. But you need to have that facility to do that. And yes, you need patience and you need time. And so I wonder whether these are going to be the labs of the future. I think a digital lab is probably the next step to test these out and see where the danger points are, where the leak points are. That's probably where we're heading.
That makes a lot of sense. Yeah.
So what advice do you have for other clinicians who are listening, and how should they consider how to get started with integrating AI into their work?
Advice for clinicians is get involved now. So for me, working in digital health for a while now, I think firstly, it's embedded into our system. So I think potentially even remove the word digital and stop putting that into a different category, because whether you like it or not, we are already digital. And so to me, you've got whatever tools that are available, learn how to use them and be involved with these conversations and get involved with building the platform in terms of how you want it to work. Because some of the time the people building it don't necessarily understand or know your workflow. And it's different to your communication style. I think your workflow is really important. So understanding how it actually works on the shop floor and the time constraints you might have. If you're seeing 20 patients in a clinic and spending less time with them versus a longer consultation and fewer patients. I'm involved with a conversion to a digital informed consent process for the state. That is really important in terms of what type of system gets installed. And can we still maintain the efficiency of a paper-based consent? Now that we are changing something from analog to digital, can we rethink why this is being done, and can we do it in a better way? And so one of the things that we've put in for the digital informed consent is now we have the ability to get information to the family about the procedure, but in that system, they can now go back and look at all the fact sheets, they can look at all the reference material in their own time, and then they can sign the consent in their own time. We've created an arbitrary 2-week period for the non-urgent operations. But they've got 2 weeks to go and look at it. They can consult with other people if they want to. And then when they're ready, they sign. And then once they're signed, then they get allocated onto the waiting list. And if they haven't signed in 2 weeks, then that's the bit that we have to follow up and say, look, just checking, seeing how you're getting on. Again, it's increasing that communication. So I think things like this, in terms of working with the teams who are implementing, get involved now. And in terms of how do you learn and how do you start experimenting, that takes time. And so that's working with other engaged clinicians, potentially doing some courses. And there are some courses around, but I think people like me, we're still kind of figuring out ourselves. And I'm starting to just start producing some educational material now because of where I'm at. And so I think for people like me, getting together with the other techies and saying, okay, how can we teach this in a way that it's going to be safely implemented?
You obviously have the mindset of a clinician scientist. Your curiosity is obviously still the same as what it was when you started med school many, many years ago. If you were to give advice to young doctors and young people going through training now, what advice would you give them around maintaining that curiosity throughout your career? Because we often hear burnout and people leaving the system. But the reality is that if you're passionate about learning, as you seem to be, that you find new ways of innovating. So what advice would you give a young doctor to maintain that curiosity and desire?
I think a lot of the burnout happens when the perceived expectation is different to reality. As a junior doctor, you're shaped by the engagement and curiosity and enthusiasm of your seniors and mentors. So getting past some of the bureaucracy, understanding the systems better. So I think that's where a lot of burnout happens, is you're no longer providing care. You're filling tick boxes and you're doing a bunch of bureaucratic process to achieve that same level of care. And it takes a whole lot longer to do the same thing. The other problem I think happens is, as a junior doctor, you no longer see the impact of your actions, which is what I was able to do, or at least I could see the bigger picture. And that, I think, is what erodes some of the joy that you get out of medicine, is seeing the impact. Now, how do you maintain the curiosity and the enthusiasm? I think there needs to be a slight change in the balance of the hours and what you do at work. And I know that I'm definitely not in the majority here, because I also believe in safe hours. I used to turn up at work on a Friday and then go home on a Monday evening. That's also not right. You can't have that either. But in that time, you learn to manage fatigue, you learn to manage your safety risk, and you have to continue looking after whatever the problems are, because to provide empathic care, because you're it. So you have to solve your own problems. There is a balance that we need to come back to, and I don't have an easy answer for that.
So if you look 5 years ahead, Bhavesh, how do you imagine the experience of healthcare for clinicians and patients will change thanks to the incorporation of AI? With full disclaimers around future gazing when it comes to technology is always a very tricky endeavour, but I'm going to ask you anyway.
I think in the future, I would hope in 5 years that we no longer have a keyboard in the room, and there may or may not be a touch screen. I think there should be some visuals. So all of the appointment logistics will be automated, and the actual clinical interaction will be more meaningful. So there's no keyboard. There's visuals there for ingesting information easily, and your AI agents will essentially do the jobs that come up in the consultation. I think also by that time, quantum computing will be very much more easily available by that time. So I think by that time, we'll have more information in terms of genomics. And so the types of problems we're dealing with we'll have a lot more information about these conditions, I would hope. And so then moving towards preventative care and more proactive care, I think will be able to be emphasized more. I think that's where we're heading.
Well, I think you're incredibly inspirational, Bhavesh. Thank you so much for everything that you're doing and leading the way and sharing your knowledge. You're such a busy person. And when I messaged you, because we had a cancellation at the last minute, and I was like, oh, I need someone for the next show, you just responded straight away with, yep, no worries, I can fit it in. And you're speaking at a conference today, so you're probably not even at home. I just really appreciate it because we want to amplify stories like yours and inspire others. So thank you so much for coming on the pod today.
No, thanks very much. I think the work you're doing is excellent. So spreading this and sharing information like this is really valuable. So thank you.
Yeah, thanks. It's been a really fun session. A couple of really interesting doctor discussions over the last few interviews, and I'm really enjoying it. Thanks a lot.
Excellent. Thanks.
Well, that is the end of another show. Thanks for listening to Pulse, brought to you by Pulse IT News. Pulse is produced by Ivan Jurek of Octopod Productions. Thanks to Emily Mara, co-founder and publisher of Pulse IT News, for her support. Big thanks to everyone for listening. Please make sure you subscribe, follow, and rate us wherever you get your podcasts. And of course, don't forget, you can visit pulseit.news to sign up for the e-newsletter and explore Pulse IT's massive digital archive. Send any feedback or topic suggestions through to George and I at pulsepod@pulseit.news. We love hearing from you guys. Have a great day.